It is. It's really busy. There's a lot here to see. You've worked really hard setting up all these booths. How many are there?
We have over 80 vendors and exhibitors here today. Lots of things for all ages, everybody from the babies on up to the grandmas and the grandpas.
There's a lot to learn. Health is an important issue, and there are a lot of booths here that deal with everything from osteoporosis to mammograms. What else?
Oh, we have a lot of information on cancer issues, sun sense, as well as lots of safety things from child seats, infant seats, all the way to child identification. We want to be sure that everyone out there has their child ID'd positively with fingerprinting, so that if in the unfortunate event that they might need to have that information, they'll have it right here today.
Well, we appreciate all you've done, Johnine, in organizing this, along with Judy Cox.
You bet, and everyone else. An event like this doesn't happen without many, many hands, so our thanks go to all the people who are here today.
Yes, and I did want to welcome the new CEO, but he is not here yet.
He is not here yet, unfortunately, but we'll have him May 1st, so we're pretty excited here at the hospital.
And his name
is Doug Foss, F-A-U-S. Foss.
Okay, and we'll have to do a show with him and come and meet him.
That's right. Welcome him to Fairfield.
Yeah, so if you get to watch this, we welcome you anyway. But thank you, and we'll go ahead and take a look at everything that's going on in the hospital for the health fair, and hope that maybe next year you'll have another one.
Well, we'll see what the foundation wants to do, but step right in. Maps are available, and you just follow the trail.
Thank you. Debra Seyfert, thank you for allowing us to do this. You have worked on the Jefferson County Hospital website.
Yes, I have. With some help, though, not just me, so.
Oh, it's a big project, and it looks like there's something that the public can, if they have a computer, check this out, the website. Why don't we take a quick scan through here and just tell us about it?
The website is www.jchospital.org, and what it allows you to do is any of these items that I'm highlighting on takes you to another page and gives you information. You can go to About the Hospital, and then you can scroll down through, and it more or less tells you areas that are going on here that is offered at the hospital. And then you can, of course, go back to the main page, and then you can find out about the foundation, of course, and who its members are, and the mission statement, of course. And
all the members?
All the members, and there are the board members, the trustees. So if you would like to find out about them, they are all on here too.
How nice.
And with little information about them. Also, there's about the staff, services that we offer. So it's more or less giving you all the options at your fingertips at home that you can visit without having to actually come out here before you actually
get a lot of questions answered
you can get
before.
Questions answered, and there is weekly bulletins that go on the website. There's a calendar to offer you assistance to tell you what's going on through the month. Just more or less information at your fingertips for at home, so that when you come out here that you have information to more or less guide you through the hospital.
That's a great idea, and you're really up to date. And I hear that you do have the new CEO on here?
Yes, we do, and his picture is here. We did get that added, and he's a very nice gentleman.
Where is he from?
He is from Montana.
Montana.
So
looks fairly young.
He's very young, but he's also a very nice gentleman.
I'm sure young and enthusiastic. It'll be great to have him here.
He will be a very good asset for this hospital.
Thank you, Debra.
Thank you.
Linda Marley, you are with the county again.
I'm with Jefferson County Hospital. I'm the radiology department manager.
Okay, and we're going to, right behind us is a video that's explaining the new equipment in the mammography department.
Yes, the hospital has recently purchased new mammography equipment. We've bought a Siemens Mammomat 3000 to have in-house here at the hospital, as opposed to the mobile service that's been serving our hospital for years. This will allow us more appointment times, more flexibility for our patients. We'll be doing mammograms actually Monday through Friday instead of just a couple days a week.
So a person needs a referral from their doctor to do this?
Yes, they do. They need an order from their physician in order to have any kind of diagnostic testing within the radiology department. So we recommend that they see their physician, get a breast examination, and then have their mammogram.
Okay, and I can't say how important this is. I was just visiting here today at the hospital, at the health fair, and my neighbor, my previous neighbor, just told me that she had breast cancer and went through all this, and that so many people do need to do self-examinations, very important, and then do this. And how often is this supposed to be done?
It depends on your age. They recommend a baseline at age 35, and then every 2 years until age 40, and then yearly annual mammograms after that. So breast self-examination is extremely important. Mammography is very important. Early detection is the key to breast cancer. Early detection provides better options for treatment, so very definitely the key.
Yes, and like I said, my neighbor I just visited with said that she caught it fast. She's not going to have any chemotherapy or radiation, and I'm so thrilled that she's doing so good and that she did catch it so fast. So thank you for what you do, and to the Jefferson County Hospital for this new piece of equipment. And I know that this was made possible by
the Jefferson County Hospital Foundation, and then we have also received some donations from the auxiliary, and then there are some money donated by Mary and Carl Zillman that is also being put forth toward this project. So we're very excited about being able to bring this to the hospital and to the community as a whole. It'll be a nice addition to our hospital.
Yes, thank you. Linda Jones, you're from Cedar Rapids.
Yes, I'm from Fittings Unlimited. We're a mastectomy shop for women that need prosthesis and mastectomy bras. We also carry swimwear year-round to meet their needs. And we do compression garments if they run into any lymphedema problems in the arm. We also do compression garments for people that have leg problems like ulcers or swelling or skin grafts and so on. We do general bra fittings and nursing bra fittings.
Okay, so that's a lot of variety. Maybe we can take a look at some of these things. These are things that people do not get to see unless probably they really need them and come to you.
Absolutely. This is an example of a lightweight, because some women do need a larger form and they get so heavy that a lightweight is a blessing.
What is that made out of?
It's a silicone. We actually have the new one by Amona that sticks right to the chest wall. It has a silicone adhesive gel, and they just can stick it right to their chest wall, and I hear that it makes wearing clothes, they fit a little bit better, and they just, to have that weight back on the chest wall feels good to them.
I'm sure after going through this is an important part of making a person feel good about themselves.
That's right. When we see a woman come through the door, you can see the apprehension in their face. They don't know what they're going to be dealing with. And by the time we're done, we take as long as it takes until they feel really good about their fitting. They walk back out and you see the attitude. They're much more self-confident again. They know they look good in their clothes, and they just feel good about themselves again. And that's why we also have silicone forms that fit in the swimwear. Getting back to their normal activities is very important for their confidence and self-esteem and just their health and well-being.
Yes. What are some of the other products that you have?
Like I said, that if they have any problem with lymphedema in their arms, we have a compression arm sleeve that, of course, has to be recommended by a doctor. We need a prescription. Sometimes it goes into their hands, and so we need to have them wear a garment on their hand. And then, like I said, other people can have problems with their legs, and so we have high compression stockings to take care of swollen, tired, achy legs or varicose veins, or if you get into more serious problems like cellulitis or ulcers or skin grafts. We do fittings in the hospitals all throughout eastern Iowa, actually. We go to the University and Mercy and St. Luke's and Cedar Rapids.
Okay.
And then we also carry some gorgeous wigs for the woman who's going through chemotherapy. And of course anyone else that needs a wig, and we carry turbans. I don't have here today, we do pneumatic sequential pumps. That's if a woman gets into a problem with lymphedema or swelling in her arm and the arm sleeve is not enough. We then have to use the device to pump her arm down, get the fluid out of the tissue and back into the circulatory where it belongs. And then she needs to wear the arm sleeve to maintain the reduction. So there are a lot of phases to breast cancer that not every woman knows about.
There certainly are. I didn't know about some of these, and I want to thank you for coming all the way from Cedar Rapids to Fairfield for the health fair at Jefferson County. And we're looking at right now.
Those are gorgeous swimwear that we carry year-round. They are both for mastectomy and women that have not had mastectomies. We also try to carry wraps, and we carry them through the winter for the woman that wants to get to aerobics or is lucky enough to go on a cruise. And we try to have something that's appropriate as we age, something that's going to be flattering with tummy tamers and lower fitting legs.
Those are really attractive. Wow, that's impressive. Thank you once again.
Hi, I'm Stacy Insminger with the Lockridge Emergency Response Unit, and we're at the health fair at Jefferson County Hospital doing blood pressure screenings, which the normal range for blood pressures is 120/80. And the reason that we check it is because it is a symptom for strokes and heart attacks, and something that can be controlled with medicine. And so we're just letting people know what their ranges are today. And yours is 132/88.
Sounds about normal. I'm Trooper Bowen with the Iowa State Patrol today. We're at the Jefferson County Health Fair. Today we're talking about seatbelts and safety and airbags. Today we've got a typical child safety seat that is being designed and being used among the public now. It's made out of plastic. It's probably one of the best ones that is being made now. We have a lot of materials that explain how the seatbelts and child restraints work. We also have a deployed airbag that gives people an idea actually to see what actually an airbag feels like, what it looks like, actually how it comes out of a steering wheel system. And we have a older child restraint seat that had been involved in a automobile collision where actually it was a side impact collision, and a child actually survived through this collision. Unfortunately, the mother of the child did not survive, but the child actually survived through the collision. But we're glad to be here with the Jefferson County Health Fair and demonstrating how child safety seats work.
Hi, I'm Emily Eminen. I'm from the Jefferson County Children's Alliance, which is a child abuse prevention council. We meet the third Monday of every month at the United Methodist Church. And this is Happy Bear. He helps us prevent sexual abuse with children. Happy Bear never says anything, but he has a teacher that shows how to help children learn the ways to combat child abuse and to say no to things that are wrong sexually that are being proposed to them. Happy Bear always is a good student, and this year he will probably be presenting a couple of programs at the public library for young children, either in preschool or about kindergarten age. Also, today we have a table of literature. We're giving kids tops because kids are tops with JCCA. We are also giving out a lot of literature for adults to help them recognize child abuse and to prevent it. And today happens to be Child Abuse Prevention Day in the state of Iowa and across the nation. Also, if everyone wears a blue ribbon, that helps us get the message out to prevent child abuse. This is Child Abuse Prevention Month throughout the whole month of April. We'd like for you to be watching your paper, listening on KMCD for radio spots about child abuse prevention. And if there's any way that you can help us prevent child abuse in this state and across the nation, we would be so grateful. Thank you very much.
Okay, we're here at the health fair, and I'm talking with Jewell MacDonald. So tell me, what are you doing here?
Well, I'm coming down to introduce people to Hatha Yoga, which is a very gentle way of moving and breathing to help open up constricted muscles and to create health, balance the physical system, all systems.
Now, do you need to be in really good shape to do this?
No, as my husband says, never too stiff to start.
Your husband says that, all right. So this could be for somebody who doesn't know anything about yoga or somebody who has been doing yoga for a while?
No, these classes are geared towards people who have never worked with this health system before. So we work very gentle and very somatically, meaning we bring a lot of awareness into how we move, and working with the breath and the movement, we find being in the moment where we are and move our boundaries from there. So we create great flexibility, great strength. And the Hatha Yoga system itself is a very ancient science geared towards creating health and also towards maintaining it. So it strengthens and balances every system of the body. It'll strengthen the immune system, the circulatory system, the digestive system, plus help realign the physical structure, the muscular system, the skeletal system with gravity. Okay. So you create more vitality and more grace in your life, more energy.
So if you had to say in one sentence, what would be some very basic benefits that somebody, who doesn't know anything about yoga would come into this class, what could they expect?
Reduces stress. One of the things that Hatha Yoga does is reduce stress. And when we reduce stress, we bring more vitality, more life force into the physical body. And much illness today is simply the response to a stressful society.
So if you do yoga, you'll become healthier and maybe have more energy?
Healthier and happier.
I like happier.
Yeah.
All right, great. Thanks.
It's a benefit. You're welcome.
All right. Now you've got a free introduction coming up,
I have an intro class coming up Monday, May the 15th at 7 p.m. And again, this is an intro class, explains the basics of Hatha Yoga, and particularly how I work. There's a lot of different systems of working with Hatha Yoga. And my particular way of working is very gentle and geared towards anyone. It's not an athletic approach. It's about being in the moment and being exactly where you are.
Now, if somebody's interested, how do they get in touch with you?
They can call me at 472-4287. My classes are held at Morningstar Studio on the east side of the square.
So it's right downtown, easy to get there from you? All right. Thanks a lot.
You're welcome, Jeffrey.
Hi, my name is Tammy Hainan. I am with Southern Iowa Economic Development Association. Part of our organization is the NEST program. I am coordinator for the Jefferson County NEST, and this is a program, an incentive educational program that promotes healthy pregnancies and healthy babies. We have our classes on Wednesdays from 2 to 3. This is a program that we bring in local mothers who need education and are also able to get incentives for attending our educational programs. Some of these incentives would be diapers, diaper wipes, baby clothing, different things like that. We have about 20 moms in the program right now. We are at 114 North Main Street here in Fairfield in the SIEDA Resource Center. If you are an expecting mother and you would like to get some more information or you have an interest in this program, I would be glad to talk to you. Our number is 472-6140. You could feel free to stop in the office at any time, Monday through Friday, and I would love to show you around the nest, show you around our resource center, give you an idea of what Southern Iowa Economic Development Association does, and also what we do in the NEST program itself. So I would like to thank you very much for watching.
Okay. I'm Sandra Phillips, and I'm the OB nurse manager of our obstetric unit. We're here today just to let everybody know that we are here and offer this service at Jefferson County Hospital. We do very low-risk deliveries, and our moms get quite a bit of one-on-one care. We do about 100 deliveries a year. Right now we're getting ready to offer our prenatal classes, and they're offered quarterly at this hospital. And they are 5 sessions, and the next one will be starting on April 13th. And it'll be April 13th, the 20th, 27th, 4th, and the 11th. And they can register by calling the OB department here at the hospital. And we have a lot of neat things that are offered by the hospital. Auxiliary women, they make our hats, and also Pat Cook, who's a retired nurse here at the hospital, she makes baby hats for us. And yesterday we've just been presented with a first-year calendar, and this is also courtesy of Jefferson County Auxiliary Women. So our auxiliary women do a lot of neat stuff for our department. And today we're offering a free Jefferson County Hospital diaper bag, and everybody in our department also gets that when they come to our hospital. We give tours all the time, and we're very willing to talk to anybody that's interested in our department. And at 36 weeks, the mom gets a pre-registration packet that is full of all sorts of information about having their baby at this hospital. And so that we ask that they get that done and get that back to us so we know who's going to be delivering in our department. We give away free fruit baskets also at the hospital. And we just offer a lot of neat services here in our OB department. We refer patients to the NEST program that I think Tammy just talked to you about. And we also refer patients to WIC. And we also have home care services that can go out and see mothers. And we have a very good breastfeeding program that we have a breastfeeding educator here who is very interested in helping moms with any of that breastfeeding information that they need. And I just want to thank everybody for coming out today to the health fair, and wish everybody lots of good luck with their pregnancies.
Hi, I'm Peggy Grothy. And I'm Sarah Flattery. I'm the Activity Director at Parkview Care Center, and Peggy's our administrator. Today we're just giving hand massages that Sarah gives to people who come in on their first day. We have pet therapy that we do. We have special care unit. We have special days like Hawaiian Day when they dress up in Hawaiian outfit. Kind of the idea of our poster is to kind of give a variety of the different services and the different things that we do. Our restorative with our therapies, our physical therapy, occupational, and massage and pet therapy. Of course, we have our 24-hour nursing and certified nursing assistants that provide our care. And we also have a special care unit that specializes with Alzheimer's and people with dementia. And then, of course, our activity, I'm going to do a plug on the activities as being the activity coordinator, but firmly believe just because you come to a nursing home, you don't quit living. So I like to provide a lot of variety of activities and utilizing our community with intergenerational programs, the Adopt a Grandparent program, getting our people out in the community. There's a picture here with going to Old Threshers, like to go out and eat a lot, utilizing our resources. And of course our volunteers, we couldn't do a lot of our programming without our volunteers, so we really do appreciate everybody that comes into the facility and dedicates their time to our residents. Peggy kind of talked about the hand massages. That was just kind of a technique that we would do today, but it does give me an opportunity to visit with the residents, gives me an opportunity to get to know them with the sensory tactile stimulation that we like to provide for our residents. Anything else?
We've had a lot of fun today just meeting all the people.
Thank you.
Hi, this is Kathy Jefferson. I'm with the Skin Cancer Awareness. With Skin Cancer Awareness, what we're showing here today, we've got some toast that's on a platter here. This is what would happen if you're in a tanning bed over a period of time. You can get very dark. It looks nice at the time, but eventually it'll get dark and you could possibly get some skin lesions, which at this booth here we also have a picture of different types of skin lesions. If you see a skin lesion that's asymmetrical, border is irregular, colored is varied, or the diameter is large, we suggest you see your physician with this. We need to get it checked out. And anytime that you are out in the natural sunlight, we're recommending that you use suntan lotion of some sort. Protect your skin because it's very important that we keep on top of this. Thank you for watching.
Well, we're here with the SAFE Coalition. SAFE is the Substance Abuse Free Environment, and we're a coalition of different community organizations, agencies. One of the things that we're really encouraging people to do today is to support the Beatbox, which is a program for youth. It is usually Friday and Saturday nights. I know especially Saturday nights, a lot of kids have said that they really appreciate having something positive to do. There's a little bit of structure at the Beatbox, but pretty much it's the kids run it, but they're doing a really good job. And we'd hope that people could call a fellow named Roland Wells, also Julie Babs, and I don't see their phone number right here, but if you see an opportunity to support the Beatbox, it's a youth center for kids, and I think Fairfield needs us.
Well, we're here at Jefferson County Hospital Foundation's Health Fair, and this is the face painting booth, which happens to be one of the most popular booths, and the organizers of this are Mary Klein along with Melissa Jones. Mary, do you want to tell us a little bit about what you're doing today?
Well, we're just looking for any young person, or we've done really any age of person that wants their face or their hand painted, and they can pick from the designs we have, or some of these Pekin kids have also drawn designs that they can have painted on their face or their hand. And the Pekin cheerleaders have been here to help us today, and they have been great. Great volunteers.
We're really excited to have the kids from Pekin with us today. They're a very important part of our county, so it's a winning event for us.
Okay. Oh, and he's a good one too.
What?
Could you tell us what it's like to have your face painted?
You mean my hand?
Oh, your hand. What did you have on your hand?
It's gonna be eyes. So it's like, ooh, I have eyes on my hand. Now I can see on my hand.
That's great. What's your name?
Galen.
Galen. Look, they're taking a picture of your hand right now so they can show everyone.
Cool.
Yeah, it's not quite done yet. Huh? Oh, and your finger.
What happened to your finger?
Well, it's not real. It's a fake finger cast.
Does it feel funny?
Kinda. It's like.
How does it feel?
Well, kind of weird.
Is it soft?
Yeah.
Is it? Can you bend it?
Kinda.
Kinda. Are you having a good time at the health fair today?
Yeah, I love it.
What else have you done today?
I got an apple.
You got an apple?
Yeah. And last year's health fair, when I was coming out, my friend Anatol, he was passing by on his bike, and he stopped. He goes, "Galen, what happened?" Because he saw my finger cast. I said, "It's a fake."
Okay.
And he's like, "Ah."
Well, thank you for talking to us today, Galen.
You're welcome.
This is our cardiovascular risk booth at Jefferson County Hospital Foundation's Health Fair. Karen Shepard, our nurse manager from MedSurg, is in charge of this booth. And Karen, can you tell us what the focus is?
We've been looking at blood pressure readings and relating risk factors for cardiovascular disease to blood pressures.
And have you had a number of people stop by today?
We've had a good amount of people stopping in, yes.
That's great. We have a gentleman with us here, I think, who's not even from the Fairfield area at all. In fact, you want to tell us where you're from?
Florida, Englewood, Florida.
Englewood, Florida. And what do you think of our weather?
Well, I'm surprised. The 7th or 8th of April, having snow. Haven't seen it for several years.
That's right. We're awfully glad that you're here at the health fair today. And we're also very pleased to have Indian Hills Community College student nurses helping us at this portion. We're very interested in cardiovascular health here at Jefferson County Hospital because we know that 49% of the deaths in this county are related to this disease process. Anything else anyone has to say? Okay. Thank you very much. One of the features of Jefferson County Hospital Foundation's Health Fair is our focus on helping people understand about insurances. Here today with this project, and the project is called SHIIP, are Nancy Engwall and
Beverly Schrum
and
Jim Schrum.
So they'll tell you a little bit about what SHIIP means.
SHIIP means Senior Health Insurance Information Program. And it's been in Fairfield for about 4 years. And we give information to seniors about any questions they have about their Medicare and Medicare supplements, long-term care insurance. If they have insurance claims that are overwhelming, we try to sort those out for them, and any other information.
Beverly, what would you say is a most asked question?
What supplement should I have to go with the Medicare?
Is that an easy thing to answer?
Yes, thanks to the SHIIP organization. They have listed brochures with all the information available.
Do you find there are just certain people who are interested in this?
No, children of parents needing Medicare come to us and call us for information.
It's a wonderful service to have. How do you feel about being part of this?
Well, it's interesting, and I learned a lot for myself as going through the materials, and it makes you feel good to help somebody once in a while.
Now, I understand that you're all volunteers working with this project. How did this occur?
Well, my wife mentioned it once, and it sounded like a good idea, so I did it too.
Do you have to take special training?
We spent 5 days in Des Moines at a special school they have to train their volunteers.
Well, that is very interesting, and we can't thank you enough for being here to help us with that information. Pet Partners is a very important project at Jefferson County Hospital. We're very pleased to have volunteers who will make their very well-behaved pets available here. With us today is one of the members of the organization, and our coordinator is Melissa Leisure, I'm sorry, but maybe Melissa could start by telling us.
We started the Pet Partners group about a year ago. We've had weekend availability for quite a few different pets, and Jack is our all-time star. He's here at least once a month, if not more. He comes during the week, and our patients just love him. Brings a smile to everybody's face every time he's in the building.
And Jack belongs to you?
Yes. My name's Pam Hodges-Savels. I've had Jack for 3.5 years. I got him out of a pound, actually, in Santa Ana, California. And I found out that he's a rough-coated Jack Russell. He loves everybody. I got him into Pet Partners because he's so social. He loves everybody. So he can't wait to get here.
And tell us a little bit about your volunteerism in making him available to people.
Well, it's a joy. I have to make sure that, of course, all his shots are up to date and that he's totally groomed and ready to go. All his nails are trimmed, and make sure everything's all taken care of. So when he comes, everything's clean and safe, and all he has to do is visit with the people.
This is such a wonderful thing to have here for our patients, but he's quite a hit today with the children. Mom, how do you feel about this pet?
They're stuffing me full of food. He seems really good around kids. He's really nice, has a good temperament. He's cute, too.
And the children really are enjoying having him here today. And we really do want people to learn about this project. If you have a pet that would fit into that category, who could they call?
They can call me, Pam Hodges-Savels, at 472-7488, and I'd be glad to help anybody with most any kind of animal. There's not too many that we don't accept, and we can go through the procedure and get them qualified, and we'd love to have you in the group.
And what that means is that you share the joy of your pet with a lot of people who need that type of interaction in their lives.
Yeah.
Thank you.
Yeah.
I'm here with Naomi Greenfield, and this is the Chi machine?
Yes.
Did I say that right?
Yes, the Chi machine.
I'm going to submit myself to this. It sounds really interesting, and what's the history of this?
Well, the Chi machine was developed by Dr. Shizuo Inoue. He's the chairman of Japan's Oxygen Health Institute, and his life's work is how to increase the oxygenation in the human body. He spent 10 years researching the design and the development of the Chi machine to get just the right motion, the height, the oscillation to give the benefit to humans. In Dr. Inoue's research, he found that goldfish have the most efficient oxygen exchange of any animal on the planet. Well, what do fish do? They move from side to side in a way that we don't.
Okay.
So he developed this machine to give us that motion. Would you like to know what that motion does?
Yeah, we'll continue talking while I'm doing this. And like I said, I'm going to submit myself to this. Do I need to take my shoes off?
Yes. Take your shoes off, and Gary will get you started. So you want to rest your ankles in the footrest.
Are they in the right place?
Yes. Now Gary's going to turn the machine on for 5 minutes. You just relax, eyes closed, arms at your sides.
We'll be on camera for 5 minutes.
Okay, so
we'll take a camera break.
yeah, we'll take a camera break. So arms at your sides for maximum circulation. And when the machine shuts off, then be sure to rest quietly for another 2 to 3 minutes. Here you go. So the rocking motion of the Chi machine is stimulating the autonomic nervous system, and it opens up the bronchioles, increasing the oxygenation to every cell in the body. It's also increasing the circulation throughout the whole body and pumping toxins out of the lymph system. So when Susan gets up, she's going to feel relaxed, refreshed, revitalized, and ready to go. It releases muscle tension. It's good for all areas of health. Disease and ill health just can't exist in an oxygen-rich environment, and the Chi machine is providing as much oxygenation in 5 minutes as you would get with a 30-minute brisk walk. So it's really great for the health.
Judy Cox. We're coming to the close almost of the second year of the Jefferson County Hospital Health Fair, and again, it's been a great success.
It has truly been a success. We have had just an absolutely wonderful stream of people coming through the doors throughout the entire time. We are extremely pleased with the numbers of people that have come, the activities that we have had at the hospital fair, and we've had very positive comments. Last year we kept track of the registration, and I think we've doubled the numbers that have come through the door this year. In addition to adults, we've had many children come. We're very pleased with that.
That's great for all the ages to get to see what goes on in our community health-wise and here at the hospital. I know I was in taping the osteoporosis session with Dr. Hill, and there were probably 25 people in there at least. It was full. The room was crowded.
I'm very glad to hear that. I wasn't able to go to that program because we were running around taking pictures and doing all sorts of things, but it's been great.
Such an important issue nowadays. I learned a lot, so we'll be airing that a separate time from this tape. But it is winding down, and
you're going to have this program next week on FPAC?
Yes, we are.
Good.
Yes.
Great.
So
we like to share it with everyone, and I think we have gathered a lot of people throughout the entire community coming through our doors today.
A lot of new things also. Was the Chi here last year?
No, the Chi machine was not here last year, and that is something new that we've had. The compounding solutions was also a new booth that we didn't have last year, so we just keep adding and getting bigger and better things.
And health is a field that is constantly changing. And you have a website now, and lots to know about, and keep our community informed. So thank you for working on the health fair to start with.
It's been truly fun. I enjoy doing this very much for everyone. Johnine is a wonderful health fair coordinator. We're very happy to have Johnine do this for us.
She's done a great job putting together a well-rounded event. So if I air this again next year, and it's in anticipation of a third, we hope that you'll attend. And everyone's had a wonderful time this year. Thank you, Judy.
Thank you very much. We invite you all to come again.